Welcome to our video covering my favorite spine flow moves. And basically flow meaning from a yoga terminology background, that we're going to look at several moves that we can go through if we're experiencing back pain, if we have maybe a back injury, or we just kind of sometimes don't feel so great throughout our trunk. These are some really handy moves that you can kind of store in your toolbox with minimal assisted devices. In fact, all I'm going to use here is a rolled up towel. I do have a little bit of tape on it just to kind of keep it that way, but this is something that you're going to have in your home. So with that being said, I like to start a patient on their back, and many times it's difficult to get there, and so I kind of have to show them how to get there sometimes. But just to kind of get us started and give us a point of reference, what I'm going to do is I'm going to lay down on my back and I'm going to keep my knees bent. That's a really super comfortable position. If you've had back pain, you already know this. But then I'm going to take this towel, and it's going to require me to get this towel underneath my back. It's going to require me to have the strength to lift my hips up off the mat. And so that's kind of a prerequisite to go forward with here. But I'm going to get that towel and I'm actually going to put that right into my lumbar spine, and it's going to kind of hyper extend that spine, and I'm going to see a little bit of bow there. But that's for cueing. I want to use this to help me understand what I'm going to do in the first exercise, which is called a posterior pelvic tilt. Now, what I've done is I've preset myself into an anterior pelvic tilt, and my pelvis is literally rotating that way. But now what I'm going to do is I'm going to empower some very small, deep segmental muscle, and I am going to pull my pelvis back up. And what you'll see is it'll rotate forward that way, and then as I activate those muscles, specifically the transverse abdominis, it pulls it up. I like to hold that for about a 2-second count and return all the way as much as I can. Pain will really dictate your limits right there, but I'm going to pull up and then I'm going to come back down. And what I have noticed about a lot of patients is this is a very difficult exercise for them to learn, primarily because when they try to learn this exercise, they find that that muscle is weak. And really what that does is that gives us verification on probably why they're experiencing back pain in the first place. If there's a weak muscle set there, then there's instability. And that's very congruent with what the literature tells us about low back pain, is it's a stability issue. Next, what I'm going to do is I'm going to try to get them basically to just take those pelvic bones and move them up and down. And as one moves up, the other moves down. And basically what you can see happening here in this video is I'm just doing kind of a little rock. And that's a nice subtle movement on those joints, but it also gets some other muscles, specifically the quadratus lumborum, active, and that's a terrific way to help with back pain if you're dealing with muscle spasm. Oh, it feels great. Next, I'm going to take this little bitty towel and I'm going to move it kind of down a little more south towards my tailbone. And when I do that, that kind of prompts me to be able to now take my pelvis and actually go forward and back, forward and back, forward and back. Just think right and left are moving opposite every time. And so I'm just moving up and then down with my right, up and then down with my right. As my right goes up, my left goes down. As my left goes up, my right goes down. And I'm just doing some subtle little maneuvers with my pelvis. And those movements really affect the lumbar spine. Once I get that complete, I'll then like to do a simple little maneuver for the glute muscles, because commonly the glutes are weak. We sit a lot and they get a little bit stretched out, and this is literally called a stretch weakness in the text, but when the literature defines that, what it's saying is this muscle has been dormant. It's not being used, but it is being elongated. And so that happens very quickly as we begin to get into our third and fourth decades. So to remedy that, a simple little bridge technique can be employed. And so from there, what I do is I just tell my patients to kind of be mindful of the towel. That's a great little limiter. And then as they bridge, they want to bridge up. And notice that I have literally flattened out. That's because I've gotten to the top of the bridge. I'm also using my heels. See how my toes are not on the ground? That's a critical aspect of doing a correct bridge. If you take and use the toes to do that, you almost eliminate the usage of your glute max. So we want to really engage that glute max. That's what that exercise is for. And so I want to stay on my heels to perform my bridges. I like to have my patients hold the bridge up for 2 seconds and then come back down, and typically do as many as they can. Next, we're going to perform a series of exercises from our hands and knees. These are typically referred to as quadruped exercises. And so the first thing I have to do is get that patient into this position right here. This is my quadruped. Now what I want you to notice is we're going to repeat basically a posterior and anterior pelvic tilt. We're going to do it to the tune of something called a cat-camel. This is an exercise that if you've done any YouTube research on yoga or spine, you've probably seen this exercise. I highly recommend it. I use this a lot in my own daily mobility routine. But what I'm doing is I'm anterior pelvic tilt and lifting my head. Then I'm posterior pelvic tilting and lowering my head. This is what I would assume is the cat. And there is the camel. I can also modify this exercise subtly and move my hips more into flexion, my knees more into flexion, and lower my butt. I'm just going to limit the motion, but I'm also going to change where in my spine that affects. Typically, the lower my buttocks goes, the lower that movement is going to affect. Finally, I want to offer this exercise. This is one that I think has profound effects if done correctly. It's called the bird dog. The bird dog requires the use of opposite arm, opposite leg. So I'm going to stay in this position. I'm going to take my right arm, I'm going to put it in front of me like this, and my left leg, and put it behind me like this. Then I'm going to return to neutral, assume a stable position, and again, I prefer for my patients to keep their head up, looking forward. That gives them a gaze that is distal and helps to provide balance and stability using the visual system. It also limits disturbances in the vestibular system for balance by limiting how much head motion is occurring. Again, a 2-second count is wonderful. So, what next? Well, I would tell you that if you have back pain, one thing you also have to know is how to get down and get up from a lying position just so you can do those exercises. Getting down to a lying position is pretty easy, but getting up is sometimes often hard. People want to try to sit up like this right here and use their upper extremities. What I recommend, and what many recommend who know about back pain, will tell you to do a log roll maneuver, and that's simply taking our legs and our trunk, rotating as one, letting the legs hang over, and we push up with both hands up to a seated position. Now, once you're done with that, what you'll want to do is you'll want to get a homemade cold brew coffee and enjoy. And if you're like me, caffeine's going to make you a better person to the entire world. Hope you enjoy this video. Let me know what you think. See ya.